So good evening, myself Haseena from the Department of Psychology. So in the last video we discussed about the cocaine withdrawal symptoms and its intoxication symptoms, and also how to treat and how to give therapies with three stages. So in this video we'll discuss about how cocaine and other these substances like amphetamines and hallucinogens affects individuals' thought process and how it reacts in our body. So the first one is the effects of crack cocaine in babies. So women who use cocaine during pregnancy may lead to miscarriage and other birth defects. So individuals or the women who are using cocaine during pregnancy time may lead to miscarriage and other birth defects, like babies may born with underweight, and they may have cognitive delays or learning issues, and it may lead to some other major disorders in their future. So the next substance is amphetamines. So amphetamines is the sibling to cocaine. So it is often referred to as a speed, crystal, pep pills, or meth. So the amphetamines has many other names like speed, crystal, pep pills, and methyl, etc. So it is an stimulant drug. So like cocaine, amphetamines also a stimulant drug. So it directly affects the individual's brain activity by affecting its nervous system. So it will increase the brain activity, energy levels, and alertness. People who are using amphetamines, they'll also win. They'll be in fight or flight stage. So they are part of group known as psychomotor stimulant, which speed up both mental and physical process. So it stimulates the central nervous system. So as we saw in the before video, cocaine also triggers the central nervous system. It increases the activities of dopamine, norepinephrine, and it also involves two brain chemicals like dopamine, norepinephrine, so which plays a major role in pleasure, attention, and analyzing situations. So it will make the user feel less energetic and more talkative and more focused. So the next is the effects on the body and brain. So how cocaine affects the body and brain. Amphetamines also its effects. It will affect cerebral cortex, hypothalamus, and cerebellum. So the next one is, as we discussed in the before video, it increase the alertness, wakefulness, suppressed appetite, elevate heart rate, blood pressure, dry mouth, sweating, and dilated pupils. So it will as it has the same effects like in like cocaine. So the risk and dangers of amphetamines is tolerance and dependence. So people build its tolerance level more quickly, so it will lead to dependence and in some other cases addiction. The next one is long-term use can cause severe anxiety, paranoia, delusion, hallucination, mood disturbance, and violent behaviors. So people who are using amphetamines for a long period of time, they may experience severe anxiety and other mental disorders like delusion, hallucination, mood disturbance like mania. Yeah, we discussed about the disorder like mania in the previous video. And the next one is violent behavior. They'll behave violently. They be having aggressive thoughts and feelings. Next one is brain damage. So obviously, the long-term use can cause the brain damage, like it will affect the dopamine system, which involves in motivating individuals, and brain damage may lead to memory issues, emotional instability, and even Parkinson disorder. So the next one is hallucinogens. Hallucinogen is also known as lysergic acid diethylamide. So hallucinogens is also known as psychedelic substance. So it will affects the individual's nervous system to produce the alteration or consciousness. So this substance was discovered in 1938 by chemist Albert Hofmann. So the substance is usually colorless, odorless, and tasteless material. So even the small dosage like 50 gram may increase high cravings and high brain and physical activity in individuals. So LSD trip usually lasts between 18 to 12 hours. So the effect of the LSD usually stays between 8 to 12 hours in a day. So the intensity of the substance depends on how much dose does the person take, and what mental state does the person has during while intaking the drug. So the person will act accordingly. So the next one is sensory distortion. So changes in visual and auditory perception. Colors may appear brighter, objects may seem to have more melty and seem to move. And next one is euphoria. So euphoria is nothing but intense happiness or intense activity. Next one is laughter or crying without reason. So the person have intense mood and stableness. Sometimes the person may laugh, sometimes the person may cry. So it depends on their environment and the mental state. The next one is sudden shifts in mood. So these are the some of the common sensory distortions that person may experience while affected or while intaking the hallucinogens. So yeah, thank you. We'll discuss some other disorders and some other substance symptoms in the next video. Thank you.